everybody. Hope everyone's having a good fall break. So, to get right into it, to answer the first question, uh, I looked at the Healthy People 2030 website and chose economic stability and healthcare access and quality as my two topics. I obviously used the Healthy People 2030 website as my source for this question. And for economic stability, it mentioned that economic status can affect access to healthcare, but also that poor healthcare can affect ability to work. So it's kind of a cycle in that way. It mentioned like chronic diseases such as arthritis can really affect people's ability to work, and I thought that this was kind of interesting because I didn't think about that before, but it can kind of work both ways in that manner where poor or a lower socioeconomic status can create lower access to health, and then this creates more chronic disease that limits people's ability to work. So it's kind of a cycle in that way, and I thought that that was kind of interesting. And then the focus of the interventions from for economic stability were more focused on non-healthcare related interventions, and I thought that this was kind of interesting, and it makes sense when you think about it. But it was focused on employment programs, career counseling, and food assistance programs. And then for healthcare access and quality, I thought it was pretty interesting that it mentioned that 1 in 10 people don't have health insurance. I thought this would be a slightly better number because of Obamacare that had been implemented a while back now, and I thought that this would have been improved, but and it stated that this causes people to be less likely to have a primary healthcare provider, and then decrease access to preventative health care, and of course this creates later diagnosis of chronic disease and healthcare disparities in that way. And then interventions included for this were remote communication for appointments, and I actually wanted to get some other opinions on this about maybe some other possible interventions, because I didn't think that this would actually work that well to increase healthcare access, because a lot of people don't have access to a computer or the internet to go to their appointments this way. So feedback on that would be very interesting to me. And then I answered the question, structural racism is implicated in many health disparities that minorities in the U.S. face. How might structural competency help nurses reduce disparities and address this issue, structural racism? And I said that by understanding, or through structural competency, we can understand what creates these healthcare disparities and then develop interventions for them on the structural level and advocate for those changes. And I used page 25 of the notes for that answer. And then to provide a reflection on Module 4, I thought the most interesting thing from this module was the inclusion of food swamps. I had heard of food deserts before, but never of food swamps, which is where these areas have food, but they're unhealthy foods. And I thought that this was kind of interesting to include, and it was very important to include because they're both equally as important issues. And that was from page 40 of the notes. Thank you guys so much for watching, and I appreciate any feedback.